It is 7 o'clock here in the UK. Good to see you this morning. Our top story, reckless or right? The Prime Minister has laid out his plans for easing COVID restriction in England, but there is something of a backlash this morning over issues including face masks. We'll be speaking to the Health Secretary Sajid Javid in just a few minutes' time. The Shadow Health Secretary, Jonathan Ashworth, and a former Chief Scientific Advisor also on the show. We'll also be discussing the latest from the England camp as players train ahead of tomorrow's semi-final. Plus, I'll be speaking to one of Gareth Southgate's former players. This is also on the show.
This room is the council chamber. This is one of the coolest rooms in my house because this is the room where, in 1608, Guy Fawkes was interrogated over the gunpowder plot.
Yep, we'll be speaking to the comedian who lives in the Tower of London. It is Tuesday, the 6th of July. Unmasked. People, politicians and scientists express fears over plans to fully unlock England, with concerns over making face coverings a personal choice.
We're not wearing it. Yeah, I won't be wearing mine.
We need to learn how to manage, but I don't think we should be so ridiculous as to stop wearing masks.
Bursting the bubble. Could the mass isolation of school classes be ending soon? Key targets missed and too few staff. The calls for urgent action in England's maternity services that could save 1,000 babies a year. Ready for the fight as coalition forces head for the exit in Afghanistan. We speak to those trying to stop the Taliban regaining control.
And did somebody say it was July? The weather forecast not particularly summery. All the details coming up a little bit later in the programme.
Come on! Do it!
Hope you've had your breakfast. The greatest Goonie of all, Hollywood stars paid tribute to the director Richard Donner, who's died aged 91. Morning all. Reckless and divisive are just the right thing to do. There is a bit of a backlash this morning over the Prime Minister's plans to ease COVID restrictions on July the 19th, so-called Freedom Day. Well, we've been speaking to people, politicians and scientists who are concerned about the pace of the unlocking with Delta cases on the rise. There are questions too over exactly when people should choose to wear those face masks and whether or not that should include public transport. The Health Secretary Sajid Javid will be on the show shortly, but first, let's take you through the plans outlined by the Prime Minister. First, there will be no limits on social contact, so groups of any size can meet. The legal requirement to wear face masks will be removed. Instead, people will be expected to use their own judgment, their common sense. All remaining businesses, including nightclubs, well, they will be allowed to reopen. People will also not be required to work from home. COVID passports, remember them? Well, they won't be needed for entry into events. Helen Ann Smith reports now on the mixed emotions to yesterday's announcement.
From clubs and crowds to masks and mandates. Restrictions have ruled for so long, but when is the right time to reverse them? In Leeds Student District, relief was on order. A more normal uni nightlife now beckons. For these friends and twin brothers, there's lost time to make up.
I've spent the entire year at home. I've studied at home, I've not left the house.
I mean, if they've got football stadiums of 60,000 people in, why can't I dance harder in a nightclub, yeah?
Open them up, man. Why not? It's been a while. I think everyone's pretty much vaccinated now, so yeah, crack on.
But caution's common too, and it will take more than just rules changing to bring office districts like this back to life. Mike's consultancy was once based near here, but he's let the space go, his staff work from home. The world's changed, he says, and the virus still with us.
The people who work for us have seen positive benefits in terms of money in their pocket because they're not paying to commute. As a business owner, we've seen a positive benefit in costs because we're not paying for an office.
So would you feel comfortable bringing all your staff together in one space at the moment?
Not at the moment, no. You know, I think we've got to get through the next few months before I'd feel comfortable trying to get that many people together.
That uncertainty is reflected by many, and there's much for individuals to decide. Mask wearing on transport, perhaps the most tricky.
I think maybe once I've had my second jab, then maybe I'll stop wearing masks.
I work in an industry where I don't see many people now just because they're wearing a face mask, so I'll be happy.
We're not wearing it. Yeah, I won't be wearing mine.
You can't just put a date on something and expect people, to say, oh yeah, well, COVID is over. I mean, it's with us. We need to learn how to manage, but I don't think we should be so ridiculous as to stop wearing masks.
The government also want to end bubble restrictions in schools, whole classes sent homes wreaking havoc. But there are cautionary words from the government's scientific advisors. Another peak is still possible, putting the onus on people problematic. The strategy is now clearer. We've all learnt to live with restrictions. We must now learn to live with the virus. The end, so longed for by all, still controversial to many. Helen Ann Smith, Sky News.
Very pleased to say the new Health Secretary, Sajid Javid, joins us on the programme. Mr Javid, very good morning to you, and of course, congratulations on your return to Cabinet.
Good morning.
But what a job you have to do. I want to start, if we can, with perhaps one of the measures which has caused a little bit of debate, as announced by the Prime Minister yesterday. Face masks. Yes or no, are face masks effective in reducing transmission of COVID-19?
Well, Niall, if I can explain, we need to learn to live with the virus, and that is why yesterday I set out how we plan to ease restrictions from July the 19th, providing the tests that we've said are met. And the reason we can afford to do this, which is to move from a system of rules and regulations, including rules we currently have on face masks, to a system of guidance and personal responsibility, is because of the vaccine. The vaccine is working. It is our wall of protection. Jab by jab, brick by brick, it has provided us with this protection, which means that although case numbers are high, and as I said yesterday, I expect them to go far higher, what we are seeing is a severe weakening of the link between case numbers and hospitalisation and deaths. And that is what is allowing us to ease the restrictions in this way. So to turn to your question about face masks, that's why we can make this change and move to a system of guidance.
But as you say, it has severely reduced the link between infection and death, but it hasn't broken it. And it follows, of course, that if we are going to see, as you just put it, a very significant rise in infections, there will be a concomitant rise in deaths. So again, the question I did ask was, are face masks effective at restricting the transmission of COVID-19? And if so, why are we stopping people wearing them now?
Well, in terms of coming to the decisions that were announced yesterday by myself and the Prime Minister, of course, we've taken the best possible public health advice, scientific advice. We have the best advisors in the world. And together, looking at the impact of the vaccine and the severe weakening of that link, we, of course, are very comfortable with the decisions that were announced. Now, I fully understand why many people will be anxious. They'd want to be cautious. And that is why other protections remain in place. But the vaccines are working. And if I can just quickly share an example of why I'm saying that, is that at the moment, in the last 24 hours, we're getting case numbers around over 25,000 a day. But when you look at hospitalizations and deaths, deaths, for example, are 1/30 of what they were the last time we saw case numbers of that type. And also, when we're thinking about our health challenges and health problems, one of the things I tried to set out yesterday as well is, as Health Secretary, I'm also very concerned about all the non-COVID health problems, which, they haven't gone away. And if anything, they've got a lot worse. The waiting list has grown dramatically. It's going to grow a lot more before it comes back down again, sadly. There are many people that have not come forward with cancer problems, with heart disease problems, with mental health problems, and I'm very concerned about that too.
Minister, I completely understand that. I'm not going to ask the question again whether or not face masks are effective, because we know that they are. In the latest meta-analysis that came out in the last 24 hours, 6 million individuals involved in it, shows that it reduces transmission by at the very least 25%. So I'm just wondering about this shift that we have seen between last Thursday and yesterday evening, in which, we're not being told what to do anymore. We're being given personal responsibility to make our own decisions. So on that basis, in which circumstances will you be wearing a mask?
I'll always, for the foreseeable future, I will be carrying a face mask with me. I think that's a very responsible thing for anyone to do. As I've said, the pandemic is not over. And if I'm in a crowded or enclosed space, I will wear a face mask. In fact, I'll wear one if I was next to someone or near someone that felt uncomfortable with others not wearing face masks.
So that's the point.
And that's what I mean by personal responsibility.
Yeah, but also, we learned this morning from the papers, and in fact I've stood it up myself, government advisers have been briefing out this morning that vulnerable people who may well be concerned about travelling on public transport, given that many people will choose not to wear a mask, you've given them the opportunity to do so. The advice from government for vulnerable people, people with maybe suppressed immune systems and so on, is to travel outside peak times. So we're telling people who perhaps have received a cancer diagnosis that they will have to take a bus at 5 o'clock in the morning. That's what this government means by personal responsibility.
Well, I've given an example of when I would wear a face mask, and I hope other people would do similar. But again, to turn to your particular question on face masks, why can we move from a system of rules and regulation to guidance and personal responsibility? It is because of the vaccine. The vaccine is working, and the fact that now we've got the most successful vaccine rollout program in the world, thanks to the NHS and our scientists. What we have is a situation where I think some 4/5 of adults have had at least one jab, some 3/5 have had 2 jabs, and we've announced recently our plans for a booster program in September. And the purpose of these vaccines is so that we can slowly start taking our freedoms back. People do want to see a return to something that looks more like normal. Of course, there are still other protections in place. For example, the border controls. We're going to have a more proportionate and balanced test and trace system. And so there are other things that will continue to protect us. But the most important thing is the vaccine. And I would urge everyone to make sure that they're jabbed up.
Strangely enough, I'm off for my second jab later on today, so the advice is well taken. But just in terms of...
Good luck with that.
Thank you. I suspect I might need it getting up at 2:30 tomorrow morning. But just in terms, though, of where we go next, you yourself have conceded there will be additional deaths. Increased infections means increased deaths. I'm wondering if we can get a figure, what would be an acceptable excess mortality rate from COVID-19 as we move forward?
I have to say, it's not about something, some number of deaths being acceptable. Of course not. What we are seeing is that with rising case numbers, and yesterday I said we could see a doubling of case numbers by the time we get to July the 19th, we are not seeing a corresponding increase in hospitalisations and death numbers. And that is because the vaccine's working. That's what the vaccine's for. And we can't live in a world where the only thing that we're thinking about is COVID and not about all the other health problems, not about our economic problems, our educational challenges. And we have to make use of a vaccine that is thankfully working and be aware of all the other health problems I've just mentioned a moment ago. But as Health Secretary, I tell you, when I came into this department with a fresh set of eyes, it is shocking when you look at all the other health problems that have built up. Some 7 million people have not come forward during the pandemic for help from the NHS with their health problems. 7 million people. Now, just think about all the health problems that have been stored up, and we need to treat that as a priority too. It cannot just be about COVID.
Sure, indeed. And as you mentioned, the fresh pair of eyes that you bring to it, it has to be said, your approach, that which we heard from you yesterday and the Prime Minister, is a country mile away from what we were hearing from the previous Health Secretary. You have to concede that it is a different approach, and that, frankly, if Matt Hancock had remained in post, we probably wouldn't have had an announcement of the type that we had yesterday. So I'm just wondering what has changed. The sage advice has remained the same between Thursday and today. The advice in terms of the data set has all been going in exactly the same direction. To my mind, the only thing that has changed is that we all had to swallow a gallon of mind bleach after we all got to see the former Health Secretary grabbing his aide's backside. I mean, where is the science that has led us to making this fairly fundamental change in approach?
I think what's changed since this pandemic is obviously we've learned a lot more about the virus itself, and I've said a lot about the vaccine, but also it's worth mentioning the treatments are much, much better than they were at the start of this. One of my first visits, I think on my second day on the job, was to St. Thomas's Hospital, and I went to see the doctors and the consultants in the wards where they were previously treating hundreds of COVID patients, and now at the time I went, there were hardly any. But what they also explained to me was the impact of the drugs, the treatment that is now available, especially dexamethasone, and that's important too. So that's something that's changed since the pandemic. But most of all, what's changed, and again, I have to come back to it is the vaccines. They are working, and it is allowing us to take the measures that we announced. But let me say again, I absolutely can understand that many people will be cautious, they'll be anxious, they'll be concerned. I absolutely get that. The Prime Minister does, my colleagues throughout government do, but we have to take advantage of the vaccines and the protection they're providing, how they have severely weakened the link between cases and hospitalisation. And no one's pretending here that this has all happened before somewhere and there's a risk-free way out of this. We haven't pretended that in past pandemics they've been very different, and so we have to learn as we're going along, but we're getting the very best advice that there is available in the world from the best scientists in the world, and together with their advice we're moving ahead.
Do you understand why some people found it curious to hear the Prime Minister, speaking from Downing Street yesterday, lecturing us all not to be demob happy on something that this government has become very fond of describing as Freedom Day?
I didn't quite get the question. I'm sorry, you cut off.
Sorry, I'll repeat it. Do you understand why some people find it curious that the Prime Minister told us all yesterday not to be demob happy, to go wild, to enjoy ourselves too much on something the successive government ministers have been happy to describe as Freedom Day?
Look, I think that what the Prime Minister is reflecting there is that still advising people to take notice of the guidance and to emphasise that we expect and hope people will show personal responsibility. And I know people will. If you look at the huge efforts that the British people have made during the course of this pandemic, obviously not just following rules, but just taking a more common sense approach to social interaction, for example, that is what I think will continue. And I think that's what the Prime Minister is emphasising. That's something that we'd all like to see.
Just in terms of what might happen later on in the year, we heard, of course, from Chris Whitty, the Prime Minister, and yourself have all said that winter may be difficult for the health service. On that basis, can we just be absolutely crystal clear? The government retains the power to reintroduce restrictions later in the year if necessary, if, as I'm sure you would say, absolutely necessary.
Look, one concern that is still there, and this is throughout the world, is that there will be new variants. I think no one can rule out there won't be further variants of COVID, and no one will know what they will look like. There is a risk, and I think it's a real risk, of some kind of vaccine-resistant variant. There's no sign of that yet anywhere, but I think it's something that no one can rule out. And that is why it's sensible to retain some powers. And one of the things I said yesterday, for example, that local authorities will retain their powers at least until the end of September, and before that date we will review them again. So if there's a need for the local use of powers, that is something that can be done promptly. And so it's important, I think, to remain cautious in that way. It's why we will also retain border controls. Your viewers will be familiar with the so-called sort of traffic light system. That will stay in place. There may be some proportionate changes to that. I think the Transport Secretary has already said that we can soon afford to treat people that are double vaccinated travelling to amber countries differently, but that will also provide a degree of protection. And then also there'll be a more proportioned and balanced test and trace system. So I think that all of these taken together are there to continue to protect us, especially against the emergence of a new variant. But at all times, we will, of course, keep this under review.
Mr. Javid, as I said before, congratulations on the return to Cabinet. Very big jobs to do.
Thank you very much.
Thanks very much for being with us. Thank you.
Thank you for having me.
Well, let's take a quick look at the latest coronavirus data for the UK. There have been 27,334 new cases. 9 more deaths were reported, which means the total number of people who've died within 28 days of a positive test now stands at 128,321. Well, the latest vaccination figures show another 77,222 received the first jab. 111,410 received their second. In total, 33.7 million have now received both doses of a COVID vaccine. Restrictions on British travellers into Germany have now been reduced, meaning that people can enter the country as long as they adhere to the 10-day quarantine upon arrival. This can, however, be shortened, pending a negative coronavirus test. Those people that are fully vaccinated, well, they can avoid it altogether. Meanwhile, despite the new government guidance we were just discussing with the Health Secretary, Ryanair says all passengers will still be required to wear face coverings. Although it was announced on Monday that masks are no longer a legal requirement in most settings, the airline has stated they will still be mandatory on all of their flights, regardless of the destinations. And as the vaccine rollout continues here in the UK, the Mayor of London, Sadiq Khan, has announced a new incentive to get Londoners to go for their jab. You might be wondering why we're looking at pictures of England fans. Well, here's the reason. 50 pairs of tickets to watch the final this Sunday in the Trafalgar Square fan zone could be won by anyone that comes forward to get their first dose from Wednesday. One person and their guests will also be invited to watch the match live at Wembley. Yeah, fingers crossed. Here's how the morning's papers are looking, starting today with the Daily Express. It quotes the Prime Minister. It's now or never, but also pictures the teenager Emma Raducanu, who was forced to withdraw from Wimbledon. Free Lions, the headline in The Sun, heralding the end of restrictions and also, of course, looking forward to tomorrow's semi-final. A different tone, though, from the Metro. They say that Boris rolls the dice following yesterday's announcements. Likewise, The Guardian calls the upcoming changes a gamble, citing scientists concerned about the changes on the 19th. And The Mirror warns that the government is masking for trouble. They quote a bereaved son concerned with the scrapping of mandatory mask wearing. Plenty coming up on the show this morning. What is the Labour Party making of the move to remove restrictions in England? The Shadow Health Secretary Jonathan Ashworth will be joining me in the studio at 25 to. At 8:20, Jeremy Hunt joins us to discuss the Health and Social Care Committee's new report into maternity care services in England. You want to see that one? And at 9:15, I'm joined by the former Middlesbrough midfielder Josh Walker, who played under Gareth Southgate. We'll be discussing England's chances tomorrow night. An immigration shake-up is on the cards. Our reporter Aisha Zahid joins us from the newsroom. Aisha, good to see you this morning. Just take us through this. Priti Patel has talked about this for quite some time, frankly.
Yeah, they've been described as radical changes as part of Home Secretary Priti Patel's plans to fix the UK's broken asylum system. Now, earlier this year, we heard about the idea of offshore migrant centres. It's not clear whether these will be announced today, but we do know there will be harsher penalties in place for anyone entering the UK without permission knowingly. They face up to 4 years jail sentence, and for people smugglers, others. They could face a life sentence as opposed to a maximum of 14 years. And the Home Office have said they hope these will help tackle asylum shopping too, essentially when the UK is picked over other safe countries. But there are major concerns, with charities warning thousands of migrants could be turned away and left without the help they need.
Aisha, many thanks indeed. Now, more changes need to take place in England's maternity services in order to keep babies safe. That's the warning in a new report that's led the chairman of the Health and Social Care Committee, Jeremy Hunt, to warn that around 1,000 more babies would live every year if we copied Sweden. Sky's Becky Johnson has the detail.
These babies should still be alive. Their deaths the result of avoidable errors with devastating consequences. Joshua would be 12 by now. Pippa would have started school. And Winter would be a toddler with a new baby brother or sister on the way. Her parents terrified of losing another child.
We got to the birth of our daughter and it all went wrong, and she was healthy. There was no need for her to have died. We'd been left in labour for quite a long time. We hadn't had the correct monitoring that we should have, and Winter was failed on numerous occasions, and she died 23 minutes after being born.
It's scary, isn't it, that we know that we've got to face those fears again at a time when we should be enjoying a pregnancy. Sarah says, "Oh, come and feel baby kicking," but you kind of don't want to get too attached, just in case.
The trust that runs the Queen's Medical Centre in Nottingham has apologised to Winter's family and committed to improving maternity services. But a report into maternity care across England says significant extra investment is needed to tackle widespread staffing shortages and highlights a culture of blame when things go wrong that means mistakes aren't admitted and lessons not learnt.
I think questions really need to be asked is why this has been allowed to happen for so long.
Richard Stanton and his wife Rhiannon have been fighting for lessons to be learnt since their daughter Kate died 12 years ago.
The findings within the report, if they are taken forward, if they are implemented, babies' lives will be saved, mothers' lives will be saved, there will be positive outcomes.
But change would be too late for them, and the many families denied the chance to see their children grow up. Becky Johnson, Sky News.
Time for a look at some of the day's other news. And around 150 students are missing after armed men raided a boarding school in Nigeria's Kaduna state. The attack is the 10th mass school kidnapping since December in the region, which authorities believe are motivated by potential ransom payments. The police have stated that they are in pursuit of those involved in this most recent incident. Cislin Faye Allen, Britain's first black policewoman, has died, aged 83. The announcement was made by the National Black Police Association. In a statement, they said that Ms Allen broke down barriers and will have had a long-lasting legacy in the policing world. Now, the remains of 4 more victims have been discovered following the collapse of a residential building in Miami just under 2 weeks ago. Apologies for the lack of pictures there. This brings the total number known to have died to 28. 117 people are still missing. To sport, Great Britain's Emma Raducanu has been forced to retire from her 4th-round match against Alja Tomljanovic at Wimbledon. She was experiencing breathing difficulties. Raducanu had been noticeably struggling, and after consulting with the trainer and the doctor, she took a medical timeout where it was deemed she could not continue. She will be back, though. She will be back. Now, the Hollywood director, Richard Donner, his credits include the original Superman film and, of course, The Goonies, has died, aged 91.
Easy, miss. I've got you.
You've got me. Who's got you?
Convinced the world that a man could fly. Well, that Superman movie, released in 1978, saw Donner face off with producers over the need for special effects that would convince the audience that a superhero could really fly. Donner also cast Christopher Reeve, who was then associated with Superman, well, for the rest of his life, and rightly so. The heads of Marvel Studios and DC Entertainment, producers of most of today's superhero fare, both worked for Donner when they were starting out in Hollywood. But here is my favourite. Oh, this way.
Come on! Do it!
Who can forget that iconic scene from The Goonies, released in 1985? The film, which follows a group of children hunting for a hidden treasure, has become a cult classic watched by multiple generations. And in reference to that particular film, Steven Spielberg hailed Donner as the greatest Goonie of them all. And in reference, well, we've just read that. Yeah, the actor Mel Gibson, who found fame starring in the Donner-directed Lethal Weapon series, described Donner as his friend and mentor, saying he left his ego at the door and required that of others. He was magnanimous of heart and soul, which he liberally gave to all who knew him. If we piled up all the good deeds he did, he continued, it would stretch to some uncharted place in the firmament. I will sorely miss him with all his mischievous wit and wisdom. Time now for the weather. Joe is standing by, and Joe, it was tipping it down in the wee hours, I know, because it woke me up.
It was absolutely horrendous, honestly. So much rain around this morning. Dreadful driving conditions, literally puddles everywhere, surface water, a lot of spray coming off the roads as well. So do take care if you're out and about. This area of low pressure is going to pretty much stay with us till the weekend. Not quite as bad, but still with us. Let's take a look.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Yes, it certainly arrived with a splash and it's still with us now. It's made its way in overnight. The heaviest rain currently over parts of northern England, parts of Wales, parts of the Midlands too. So do take care if you're driving. And through the course of the day, it will eventually start to spiral away in towards the North Sea. It'll be the northeast that hangs on to the very wet weather longest. So for today, then, it is very blustery down to the south, gusts of 40 or 50 miles per hour along those southern coasts. And probably the best of the weather is likely over the northwest of Scotland. Here we'll see some sunshine and dry conditions. Through the course of the day, then, that wet weather continues to move its way northeast, was affecting northeastern parts of England, eastern parts of Scotland. Elsewhere, we'll see showers. Those showers, as I say, blustery down in the south, some sunshine in between. Top temperatures around 21 degrees Celsius, that's 70 degrees Fahrenheit, but not really much of an improvement as we go through the day.
The weather, sponsored by Qatar Airways.
Joe, thanks very much indeed. Well, ahead of tomorrow night's semi-final fixture against Denmark, let's take a look inside the England training camp. Midfielders Jack Grealish and Phil Foden, alongside left-back Ben Chilwell, got their preparations for the clash well and truly underway. Look, they're even doing keepy-uppies. If England can pull off a win tomorrow, they will, of course, earn a place in a major tournament final for the first time since, we had to mention it, didn't we, 1966. And I'll be watching. You can also take us with you. You can find us on the mobile app or on our website. You can head into the live blog to watch the programme. And you can catch up on the interviews on Kate Burley's Twitter. I'll be retweeting them from mine as well. Now, in the last half an hour, the Health Secretary Sajid Javid told the programme he's very comfortable with the lifting of restrictions in England set out by the Prime Minister. I did, however, ask him about whether he would be wearing a face mask after the 19th of July.
For the foreseeable future, I will be carrying a face mask with me. I think that's a very responsible thing for anyone to do. As I've said, the pandemic is not over. And if I'm in a crowded or enclosed space, I will wear a face mask. In fact, I'll wear one if I was next to someone or near someone that felt uncomfortable with others not wearing face masks. And that's what I mean by personal responsibility.
Let's speak now to the former Conservative Health Secretary, Stephen Dorrell, of course, formerly chair of the NHS Confederation, chair of the Health Committee as well, someone, I'm sure, with a few opinions on what we heard from the Prime Minister and the Health Secretary yesterday. Good to see you, Mr Dorrell. Well, let's just start straight straightforward with that. What did you make of what we heard from the Prime Minister? Is this fixing of the 19th of July as the date for lifting all restrictions entirely advisable in your view?
Well, I think there are clearly risks. Look, I think the worst attitude to strike is to sound as though somehow we are resisting or are reluctant to see lockdown removed. I think in a funny way, the most important announcement the Prime Minister made yesterday was one that's been barely noticed, which was his acknowledgement that if this pandemic starts to take off and get out of control again later this year as the winter comes on, these changes may turn out not to be, as he has explicitly hoped, irreversible. I think the important thing is to continue to focus on the data and not the dates, to use his own phrase, and to ensure that we do respond quickly if we find there are new variants emerging or there are the load building on the health service starts to threaten not just the health of COVID patients, but of all the other patients who rely on the NHS.
In fairness to the Health Secretary, who we had on the programme just a few minutes ago, and a new Health Secretary at that, I mean, he himself conceded that, you know, if we see variants of concern emerging later on in the year, then we could see localised restrictions take place. I suppose the question is, when we are seeing such an increase in Delta transmission at the moment, fair enough, there isn't the link to hospitalisations and mortality that we've seen in the past. But when we're seeing infections increase at such a rate, is this now the time to be giving everyone the decision as to whether or not to wear a face mask?
I think the important thing here is for the guidance to be clear, and the government's failed in the past during this pandemic to give clear advice. The wearing of a face mask in a confined space, for example, in public transport, or also in shops, actually, wearing of a face mask is something that protects your own health, but it actually, more importantly, protects the health of the people around you. And so I certainly think that we should continue to wear face masks in confined spaces for the foreseeable future, because we know that infection rates are rising. And we also know, importantly, that when there's a rising infection rate, what's being created is what the public health people call a potential variant factory. In other words, it's facilitating, it's making it easier for the virus to mutate, which is one of the key risks of the relaxation of lockdown.
And even if no new variants were to emerge, which does rather stretch the imagination a little, but even if no new variants were to emerge, we do find ourselves in a situation where the chief medical officer, chief scientific advisor, the health secretary, the prime minister all concede that, you know, the NHS is going to be under huge pressure come winter time.
Well, we know it's always under pressure, in truth, at winter time. We think it's overwhelmingly likely to be under additional pressure this coming winter because flu has been largely absent because of the effect of lockdown. So there's likely to be, or there's certainly a significant risk of a serious flu workload for the health service this winter. And also, if I may just pick you up on it's stretching imagination for a new variant. Actually, I don't agree with that. I think it's overwhelmingly likely that there will be new variants to this virus before the pandemic is concluded.
No, I perhaps didn't make myself entirely clear. I entirely agree with you on that point. There is the likelihood that there will be another variant. But Mr. Durrell, thank you for correcting me, rightly so. And thanks for joining us on the show.
Thank you very much.
But let's now get the views of Labour. As you can see, the Shadow Health Secretary, Jonathan Ashworth, joins us once again in the studio. Good to see you, Mr. Ashworth. Well, let's just be absolutely straightforward. Do you agree with that which we heard from the Prime Minister, the Health Secretary yesterday, that, you know, barring some major events, the 19th of July will be the point at which pretty much everything goes back to normal?
I don't really agree with their approach, I don't really agree with their approach. Look, I want to see the economy reopened in a balanced way. I want people to enjoy their freedoms, but we don't want a high-risk free-for-all. And remember the context which we're in here. Infection rates are increasing and will continue to increase. Hospitalisations are increasing. And in England, around 50% of the population are double jabbed. So what we're saying to the government is, look, yes, let's reopen our economy. Let's reopen our pubs, our restaurants properly, but let's be let's be cautious and let's put mitigating precautions in place. Let's maintain mask wearing on public transport and in shops. Let's ensure buildings have proper ventilation supports and air filtration systems so that the air is clean, because we know the virus is airborne. And let's give people decent sick pay so they can isolate themselves. If you're low paid, you still don't get decent sick pay to isolate yourself if you're ill. That is a massive, massive failing. So, yes, let's reopen, but let's put these precautions in place.
What in your mind, because of course one thing that was perhaps slightly glossed over yesterday is we still need to have all this confirmed on the 12th of July as to what will happen.
Yes, that is true.
A week after. But assuming that does take place, what could possibly happen between now and the 19th of July that would make you think, do you know what? Perhaps this isn't the right time to be unlocking.
Well, we've always got to look at the data, obviously, but remember what's happening at the moment. The virus is going up. Now, Boris Johnson said we'll have 50,000 infections a day by the July the 19th. Well, we had less than that when we grew our own Kent variant, the Alpha variant. And, of course, we know we've got the Delta variant here, because you'll recall that we failed to protect our borders. So there is a risk that when you've got high levels of virus circulating, that new variants emerge. So we've got to look at all these things in the round.
But isn't that going to be the case in perpetuity? That it's, you know, the COVID-19 will be around in some form for many, many years to come. There will undoubtedly be pockets of outbreaks that crop up. There will be variants, as we were discussing with Mr. Dorrell there. There will be variants of concern that emerge. But the difference is, at the moment, is the mortality has gone through the floor.
Yeah, no, but we're also seeing that people who are exposed to the virus can develop very serious long-term health conditions which risk permanent illness or permanent disability as a consequence. And, of course, we haven't finished vaccinating yet. Only 50% of the English population have had 2 jabs. We're going to get much further on vaccination. We're nearly there, but we're not quite there yet.
I'm just trying to dig down into what exactly would be the tipping point then for Labour to be able to support this. Is it then the level of double jab vaccination that there is in the adult population? I mean, if it gets to 60%, would that be enough for you? 70%?
Well, I think we've got to look at where we are in the trajectory, because when Boris Johnson says 50,000 a day on July the 19th, he's not saying that is the peak. He's not saying it's going to start coming down after that. I mean, the likelihood is this will continue to rise and rise and rise and rise to a peak probably in about August, I suspect, but we'll see, and then start coming down again. So why not have more precautions in place? If we know we're going up, why not have mask wearing in place? Why not do the ventilation until we know we're coming back down again?
Doesn't the Prime Minister, though, have a point? And there was one that apparently Chris Whitty did agree with him yesterday, that actually the summer months when children are not in schools, when the weather is more temperate, you know, when we don't have respiratory illnesses in the same way that we do in autumn and winter in such abundance, you know, doesn't it provide us an opportunity right now?
Oh, there is a logic to this, absolutely. But what I'm saying is, let's just not just throw everything to the wind. Let's have some precautions in place. But also think about the implications of what they're saying there. That suggests to me that they're expecting the immunity to wane by the autumn and the winter, and they're looking at restrictions again in the winter, perhaps another lockdown in the winter. If that's what Boris Johnson is planning, he should actually be clear with us.
But they're being relatively clear. I mean, the Health Secretary this morning on the programme asked him, do you retain the power to introduce restrictions if necessary in the winter? He said yes, localised, but yes.
Well, I mean, 2 weeks ago, or a week ago when he was appointed, he said this would be irreversible. Now already they're saying we're going to have winter restrictions this winter. I missed that interview. I'll go back and look at it later.
Please do.
But they're basically saying we're unlocking now because we're going to have a winter lockdown. That's basically confirmation of what the government policy is now.
Do you see a difference, as some was, and I made this point to the Health Secretary, but a big difference in approach between, you know, a Health Secretary that was in the job, you know, last Wednesday, Thursday, and the Health Secretary that was in the job on Friday? Do you see a difference in tone, a difference in emphasis between the two?
Not really, to be frank, because we still haven't got sick pay sorted for low-paid people. We've still not got proper support for premises to ventilate. We're leaving it all up to premises to put the ventilation in themselves rather than giving them support. We've still not got proper localised contact tracing. I mean, I suppose the difference is social distancing is going, but Boris Johnson is replacing it with political distancing because he's saying to the individuals, it's up to you. But it's not really, because if I get on a bus or a tube without my mask on, I'm putting others at risk. And that's the difference here. You know, we should all continue mask wearing because it's about keeping all of us safe.
Do you not think people are sensible enough to be able to come to that conclusion on their own?
Well, Well, I hope they are. I hope they are, but I would have maintained the mask mandate for now.
Well, if you hope they are, if you think they are, then why can't they get away with making a decision? I mean, Boris Johnson said it himself. I mean, I can't imagine the circumstances in which Mr Johnson takes a train journey late at night and, in an empty carriage these days. But, he himself made the distinction between being in a crowded place and being somewhere where, there are precious few people around. I mean, you've got to grant the British public a degree of intelligence and empathy for their fellow human being, don't you?
Well, I mean, well, indeed, that's an important point. But look, Israel, we know Israel have got one of the best vaccination programmes in the world. They've now got the Delta variant. They've reintroduced their mask mandate because they know that the Delta variant, if you're double jabbed, you can still catch the Delta variant and transmit it. So they reintroduced the mask mandate. And I think let's just maintain that precaution as we're going up this third wave peak to this peak.
Just kind of a slightly personal question. Of course, you've been opposite Matt Hancock for a degree of time in your post. You now have Sajid Javid coming through. What do you make of him as potential Health Secretary?
Sajid Javid? Yeah. I don't know him very well, to be honest. I mean, I know he likes to boast that he's been at Harvard studying pandemics. Well, I think he missed the tutorial in infectious disease control, I'd say that.
Well, he's quite... Well, actually, to be fair to Mr Javid, if you read his, his Harvard missives, he's quite a strong supporter of face masks.
Well, why on earth is he not maintaining the mandate? I'll ask him about that later today in the House of Commons.
I look forward to it. Mr Ashworth, good to see you this morning. Thanks for being with us. And just a reminder that if you want to catch up on any of the interview with Mr Ashworth, Mr Javid, or indeed simply watch the programme when you're out and about this morning, here's how you can do it. You can find us on the mobile app. You can head to our website. You can even go into the live blog to watch the programme, or you can switch on the telly. How about that? You can catch up on the interviews on Twitter as well. But for a bit of context to the two big political interviews we've had this morning, our political correspondent, Tamara Cohen, is here. TC, what we're learning?
Hi, Neil. Well, dividing line here. The government has said there's no need to wear masks anymore. It's the guidance still. They're saying that it's a courtesy to other people when you're in a crowded space. And if airlines or transport networks want to keep them, then they can. But it's no longer mandatory. And inevitably, lots of people won't bother wearing them. But they say, look, it's now a matter of personal responsibility. And if people feel vulnerable, then they can ask someone to put one on, but they've no longer got that protection of everyone having to wear one. Sajid Javid, to be fair, did tell us that he would carry on wearing one in some situations. This is what he said to us.
Oh, well, we don't have it, but he said it.
He said he would carry on wearing them in some situations.
Compare and contrast, though, with others in the
Labour are saying we should keep that. Why wouldn't we open up in some ways? Yes, get rid of social distancing, get rid of school bubbles, and we will be hearing more about school bubbles today, a real problem for parents and children, 385,000 of them being off school. But he says, why not do all of that, but keep the masks, keep a requirement for ventilation in schools and offices, because the vaccine rollout has only reached half of the population. So why not carry on with that for a bit? Boris Johnson's argument is, if we don't do it now, when can we do it? Because otherwise we get into autumn, the flu season, and we may not open up until the end of the year. And the government scientists are behind him on that, but they had a very strong note of caution about the need to prevent the spread of the virus, because we're already knocking on 30,000 cases a day, and it's only going to go up from there. So if there are new variants coming, we know from some of the papers published yesterday that it will make it harder to lock down, and we'll have to do it for longer.
Tamara, thanks very much indeed. Let's turn our attention to Afghanistan once again. And after 2 decades of conflict costing trillions of pounds and leading to thousands of deaths, NATO forces are now making a quiet exit. The National Army in Afghanistan will play a central role in what's to come. It is now better equipped and trained, but the Taliban remain on the offensive, threatening to return to power. Our special correspondent, Alex Crawford, has been on the ground meeting the military forces taking on the Taliban.
The Afghan army is now all that stands between every town and the Taliban. The soldiers who've relied so much on international training, air support and weaponry are now being left to tackle the Taliban insurgency on their own.
Every time that they leave their barracks, they know that they are the focus of any attacks by the Taliban, because the Taliban want to show that they're coming back into power, and it's only a matter of time before they take over.
The Taliban's already moved into dozens of districts across the country, and they're circling the capital. Roadblocks are set up to try to secure the perimeter. But the weapons on the streets indicate just how insecure Afghanis are about their own safety. The uncertainty is palpable, and there's a great deal of tension everywhere. The Afghan soldiers fear they're now fighting Al-Qaeda and ISIS, thought to already be embedded within the Taliban. And the scramble by international troops to get out of Afghanistan appears to have empowered their enemies, who've had some rapid successes on the ground.
There's an awful lot of land that they have got to try and get back from the Taliban. And without those international troops, they have got their work cut out for them.
But the civilians are growing more nervous, with reports of soldiers surrendering and bases routed. But every soldier we spoke to is putting up a brave front. The Taliban tried to disrupt by laying mines, he told us, but we use our technical teams to find them before they explode. But that confidence and the ability to take on the Taliban isn't matched elsewhere. The rocky terrain of northern Afghanistan is home to the country's most formidable fighting partnership, different fighters known as Mujahideen who joined forces to form the Northern Alliance. The relics remain in the Panjshir Valley of how they beat back superpowers like the Soviet Union and kept the Taliban at bay. Ahmed Massoud, the son of the man who led them to those victories, is now stepping up to stop this new Taliban takeover. We were given rare access as his convoy of SUVs and armoured vehicles crisscrossed the region, often at high speed. There's a feeling there's no time to lose with the Taliban trouncing areas in the north. But the security force with him is devoted to him and his cause.
If Taliban not accept peace, we will fight with them.
Okay. You're ready for this?
Yeah, absolutely. 100%.
100%.
Yeah.
Massoud was only 12 when his father was assassinated 2 days before 9/11. The young man, educated in London, has enormous support here. When he talks, they listen. And the crowds in his home region are looking to him to lead them in the new fight against extremism. The young Massoud insists the National Army needs help. And without international troop support, the Mujahideen are the only fighters who can give it. He says there are thousands like these men, armed and ready to beat back the Taliban and their extremist allies.
They're going to fight for democracy as we speak today. They're going to fight for the rights of the people. They're going to fight for the rights of women. And they're going to fight for many other values that we cherished and we love and we achieved in the past 2-3 decades. So these are the things that they're ready to defend.
The preparations for battle come amid predictions that the Afghan government's heading for a swift collapse, prompting a fresh migration crisis and increased ISIS attacks.
We are the first line of defense. We are defending Europe, we are defending the region, and Afghans are fighting not just for themselves, but for everyone.
But former President Hamid Karzai urged Afghans to all lay down their guns and saved his strongest criticism for America.
The West must explain to us the presence of Daesh in Afghanistan. It emerged during the US presence in Afghanistan in the name of fight against extremism and terrorism. So they have failed.
America may dream this is the end of its longest war, but those arming themselves now, ready for more battles, fear it is far from done. Alex Crawford, Sky News in northern Afghanistan.
Let's find out how the weather is looking today. Joe's standing by at the wall with the details. There's lots of blue on that map. That doesn't generally bode well, Joe.
No, it has to be said for July, as it is July, isn't it? The weather's really not looking terrific at all. We've got an area of low pressure, which is going to keep things unsettled until the weekend. And then we have another area of low pressure. So don't expect to get the sun cream out anytime soon. Let's take a look at the details.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Hello there, good morning to you. Well, yes, this area of low pressure has moved in overnight. It's pushed some very heavy rain northwards across the country. And if you do encounter that wet weather this morning, do take care. It's certainly going to be unpleasant as a pedestrian, but it's not very good as a cyclist or a motorist either. A lot of standing water and surface spray. And we've got strong winds as well. Those winds strongest along the south coast where there is a warning out. We could see gusts to around 40 or 50 miles per hour. So through the course of the day, then, we're expecting this wet weather to withdraw from parts of Wales, make its way out of northern England, towards northeastern England and eastern parts of Scotland. It is fairly mild to start off with, although clearer skies in the far northwest meant quite a chilly start there. But it'll be northwestern Scotland that sees the best of the weather through the course of the day. So the heavier rain makes its way up towards the northeast, and it leaves us really with showers, some sunshine in between the showers, and where you do get some brightness, temperatures up to around 21 degrees Celsius, 70 degrees Fahrenheit, but don't get too excited about it. We'll see more persistent cloud and showery rain working its way in from the west tonight, and this untidy picture stays with us into tomorrow.
The weather, sponsored by Qatar Airways.